The International Thalassemia Day is marked annually on 8th May, and it is devoted to raising awareness amongst the general public and decision makers about thalassemia and helping the global thalassemia community to connect and call for changes towards the improvement of patients' lives and well-being. Thalassemia is a group of inherited disorders of hemoglobin synthesis characterized by a reduced or absent one or more of the globin chains of adult hemoglobin. They are characterized by varying degrees of ineffective hematopoiesis and increased hemolysis. There are two major types of thalassemia: alpha thalassemia and beta thalassemia. Alpha thalassemia caused by defect in rate of synthesis of alpha chains. Beta thalassemia caused by defect in rate of synthesis in beta chains.
Causes of thalassemia. Thalassemia is inherited. At least one of your parents must be a carrier of the disorder. It is caused by either a genetic mutation or deletion of certain key gene fragments, that is, due to the absence or reduced globin protein, which includes alpha globin and beta globin.
Pathophysiology of thalassemia. Beta thalassemia occur when there is a quantitative reduction of beta globin chains that are caused due to mutation. But the synthesis of normal alpha globin chain continues as normal, resulting in the accumulation of unpaired alpha globin within the erythroid precursors. The free alpha globin chain are not able to form viable tetramers, and instead they precipitate in the red cell precursors in the bone marrow, forming inclusion bodies. They are responsible for extensive intramedullary destruction of the erythroid precursors, and hence the ineffective erythropoiesis and peripheral hemolysis occurs, leading to anemia. This in turn leading to overall reduction in the hemoglobin synthesis.
Signs and symptoms: failure to thrive in early childhood, anemia, hepatosplenomegaly, bone abnormalities, abnormal facies, skull radiographs showing hair-on end appearance due to the widening of diploid spaces, fracture due to marrow expansion and abnormal bone structure, generalized skeletal osteoporosis, growth retardation, delayed puberty, primary amenorrhea in females, and other endocrine disturbances, secondary to chronic anemia, leg ulcers, skin bronzing, hair defects, abnormalities of urinary system or genitalia, jaundice.
Treatment for thalassemia. Thalassemia major is managed with blood transfusion or exchange transfusion with chelating agents such as deferoxerox or deferoxamide that bind to iron. Deferoxamide chelate iron by forming a stable complex that prevent iron from entering into further chemical reaction. These chelating agents reduce iron overloading. Zinc or ascorbic acid supplementation may be needed during chelation therapy. Thalassemia major can also be treated by splenectomy.
The thalassemias are relatively common diseases. Genetic counseling is paramount and may even decrease the incidence of the more serious conditions. Finally, if a family have a history of the disease, so it is important that individuals who think that they might have the disease or their young child might have it needs to visit their doctor and make it known to them. The earlier the disease is known, the faster it can be treated to save the patient's life.